Hi, beautiful people. How are you all doing? I hope fine. Yeah. Today we are going to talk about the duty of a nurse here in Germany. Yeah. As a nurse, what is being expected of you to do, what you are supposed to do here as a nurse, So, as a nurse working in Germany, your duty here in Germany, they call it Pflege. So the Pflege work is for you to fleeg your patient, for you to clean your patient. Okay. Yeah. Take care of your patients. So what are the things that is being expected of you as a nurse to do here in Germany? So I'm going to tell you all what you are to do here in Germany as a nurse and what you are not to do in Germany. What is not your work? Okay. As a nurse, your main work here in Germany is to watch your patients, give them their medications. Okay. Yes. So, number one thing is that here in Germany, nurses, they just, it's only Ausbildung, as in mainly is Ausbildung. And this Ausbildung is just like 3 years. Okay. But it's just a new thing. Currently, they are just going through university for people that want to go through university to acquire their BSc nursing. Okay. Yeah. So, mostly those people that are going to university to do their BSc nursing, they are not just doing it to come back to the station and work as a nurse. So most of the people are doing it, to find themselves maybe in bureau, in the office, to do office work. Yeah. But there are some people, that will do this BSc, they will, like to work in the station. Okay. Like somebody like me, I love those nursing job. Yes, that even if I'm done with my BSc nursing, I'm not even planning today, to go and do office work straight because I love taking care of my patients. But the problem here is that sometimes you don't have that time that you need, to take care of your patients. And that's the number one reason I chose to work in the stroke units, because we don't have a lot of patients. So if it is like in Germany that you have only like big stations where you have like 20 patients, 30 patients, no, it's not for me. Yeah, because if I'm working, I will do the things that we do that will give me joy at the end. I'm not just going to work to go and do the work, tack, and go. And at the end of the month, I will get my money. No, I'm going to work, taking care of patients, to do what I am supposed to do that will even make me happy. And when I get my money, when I'm enjoying it, I know that I did that work, to enjoy. I have been able to, take good care of my patients, which till date, I'm happy that I'm doing this job and I'm doing it, to my taste. Yes. So, you as a nurse here in Germany, maybe you finish your nursing Ausbildung and you are working here in Germany. What you are doing here in Germany, what you are to do as a nurse here in Germany is, number one thing is that, yeah, in the morning you have to do your handover. After the handover, then you people will start, going to patient's room. So, but my tips is, the tip that I'm going to give you, if you're a fresh nurse and you are starting work after handover, like some hospitals after handover, they will just sit, have time for coffee. After taking their coffee, then they will start going to the rooms. So, but what you will do after your handover, you just try to go and check the patient, go to the rooms, and check if the people they handed you over, if everything is okay with them. If everything is okay with them, then you can now come back and now sit down, you will discuss, drink coffee. Then when it's time to stand, and go to their rooms to wash them, then you know that they are all awake and alive when go inside there. So when you will start the work, first of all, you have to, wash your patients. Okay. Yeah. Depending on how the bed is, you clean the bed, do everything. So after that, the next thing is sometimes before you people finish washing, the service diamond or the people that will be sharing their breakfast, they are already doing that. Yeah. But if you are lucky enough, you will have the hospital where you know is sharing food. But if you are not, you will be in the hospital where you are under stress, taking care of your patients, and you, as a nurse, will also go and serve patients food. Yes, after sharing patients food, then you have to clean it up. You have to take out the plates, and you will be the one to give the patient food. You will be the one to take out the plates. You'll be the one to clean everywhere. So this work depends on where you get your own. So if you are lucky enough, you just get where you will do, basically you will just know that you are taking care of your patients. Yes. So another thing is that, like, there are some hospitals you will be the one to take your patients, to control room, to Untersuchung. So, but there are some hospitals, they have like transport things. The people that are taking the patients for their control, to their control, to the appointment. Maybe they call them for any Untersuchung. So they have people that will take care of them, that will come and carry them from their room, take them there, and now, bring them back again. But there are some hospitals that these are the things nurses are doing that even make the work to be more strenuous. Yes. So here in Germany, as a nurse, you are not allowed to do everything. Like, in the sense that maybe you are taking care of your patients and you see that maybe the blood pressure of your patient is low, and the heart frequency is very high, and in some cases, like when your patient is dehydrated, it also increase the pulse, and the blood pressure will also be low. And one thing you need to do first, maybe depending on what is happening to your patients, you cannot go and give somebody that is health decompensated too much water. So you now check, based on what is happening to your patient, you can just give the patient like steroidine, like infusion, you know, to make the patient to have more volume, that will increase the blood pressure again, and also will decrease the heart frequency. Yeah. So before you do that, you have to consult the doctor. You have to call the doctor. Should I do this, or should I not? Hmm. But as a nurse, there are some certain things that you yourself know that you're supposed to do even before giving the patient, like something that contains calcium or nitrium or something like that. You have to go and the check the lab result of that patient and know if it is in normal barrage. So if it's in normal barrage, then you can be able to do that. But here in Germany, you are not allowed, you call on phone to do that. Let's assume your patient is having fever. You are not allowed to go and take paracetamol, you take Novalgine and give the patient. You will also call the doctor that, fish, am I free to give the patient this? So when the doctor say yes, then you do it. Like blood transfusion, as a nurse here in Germany, you are not allowed to do that. Yeah. Like taking drawing blood, you are not allowed to do that. Like putting like vigors, you know, like need infusion needle, you are not allowed to do that. You are not allowed to do that. It's only doctors that are doing it. Or maybe if you're working in set and like central unit of emergency room, then nurses are doing it there. But when you are working like nurses, like station nurses, you are not doing it. Okay, you just wash your patients, give your patients food, give them medications, change them, you go your ward round, then the people that I know are not moving on the bed, then you have to position them very well. Okay, So those are the main things that nurses are doing here in Germany. Okay, like unlike other countries, maybe yeah, but other countries, most of the countries, they are doing also a university. They do BSc nursing, so that's why most of them are also doing those things that they are doing, like giving patient transfusion or putting vigors and so on and so forth. Yeah, but there are some countries that did only that they are doing only hospital. So like people that did only hospital, that are working in the hospital, they are able also to put, like, needles. They give your patient, when you check your patient, the condition of your patient, what's happening to the patient, you can able to give the patient better, what they wrote down, that if this thing is happening to the patient, you'll be able to give it to the patient. Yes, without calling doctor or asking doctor for anything. There are people that are doing it, but everything that you are doing is just based on the organization. I'm not saying that the whole of Germany, there are not people that are maybe where I am, I'm just anything that I'm saying here, I'm just giving direct example of what I know. Okay. So where I'm working and the area and where I have worked before and the area that I am, there is no there is nobody as in a nurse that is doing that in the station. Okay, so that is just that. Those are the things that you are not allowed to do here in Germany, and I also mentioned the ones that you are allowed to do here in Germany. And most of the cases, you even do more than. So that's one. Sometimes I wonder why. Like here in Germany, there are people like nurses and nurse assistants. So there years ago they stopped them, from working from the station. But why? And now they want to bring them back again. So I asked, like, why? Okay, because those people, they are even help, like watching the patients. So you as a nurse, you just concentrate on the behandling fliege, to make the work, to ease it, to make it be more fun, and be more happy, so that you'll be more happy doing it, because you are taking care of human being, and this human being, they are not even healthy. Those people are the sick people that they need care. Okay, so you don't just go to patients, that maybe, let's take for an instance a patient with a Parkinson or a stroke patient. You don't, they are not fast. You need time to take care of these patients. You understand? So you don't just go because you don't have time and be making everything so hectic. And when you are having hectic doing your work, you are extending it to your patients. So I don't think that is a good thing. Like washing patients is something that somebody can just go and make course, like 3 months or 6 months course. They will teach you how to wash the patient. They will teach you how to give the patients food, and it will be, a relief to nurses here. But here in Germany, it's the nurses. There are people, they are doing it. You take your patient to transport. You transport your patient to the control room, to go and do the checkup. You go and share food and give your patients. You will give your patient food, those that cannot eat by themselves. You will be the person to give the patients food. Those are good. Those are okay. But at least you provide the people that will share the food. Then the nurses will now take care of giving the patients food. Okay, you provide the people, that will take the patient to Untersuchung, so that at that time the nurses will have the time for others to be doing things. So that is it, my beautiful people. So if you are coming to Germany, to work as a nurse, or you want to start your hospital here, those are the things that you need to know. Or else you just want to go and work like in the certain hour, or intensive. I think maybe intensive, they will be doing those things, but I think where I am, I think they don't do it. I'm not sure, but for Central New Tottenham, I'm sure they are the people that are drawing blood, they are putting vigors, So, but everything just depends. It depends on you. It depends on the rich tongue that you are going. It depends on the area that you want to go. Okay. So nursing is a very good job. It's a very nice job. It's a job that you'll be doing, you'll be happy. Like the way people will be thanking you because of what we are doing. is a very nice job, you know, that I'm not even thinking to stop it today. Okay? Yes. So I think if you want to become a nurse is a very nice thing. That is a very, very good thing that you start. You don't even think much about that. Just start it. Okay? So in a time that you feel that, oh, it's getting so strenuous for me, then you can now divert to another thing. But for me, nursing is a very, very nice course that, you know, you'll be happy to do. You're happy to, take good care of patients. Yeah. So those are the things that nurses here in Germany are doing. I hope you enjoyed this video. So in case you still have any question, you don't hesitate to drop in the comment section. So I'm going to see you all in my next one. Please, if you're coming to this channel for the first time, do what to subscribe, do what to like, do what to share. Okay. Yeah. We are going to see us all in the next one. Thank you for watching. Bye.